Hello, my name is Ajai Chari. I'm a professor of medicine at Mount Sinai, New York. And it's my pleasure today to talk to you about GPRC5D, which stands for G protein coupled receptor class C, group 5 member D. And this is an orphan receptor. We don't really know its function. What we do know is that it's overexpressed primarily on myeloma cells and hair follicles. And it's overexpressed in neoplastic plasma cells in particular, making it an ideal target, especially given the lack of shedding domain. We don't see a sink effect that we might see with other antigens. And the other reason this is an important target is there's been a lot of work in BCMA in myeloma, but we need other targets because unfortunately, our myeloma patients keep relapsing, and particularly those that have become penta-exposed and triple-class refractory. So we're talking about proteasome inhibitors, IMiDs, and CD38s. It's an unmet need. So here in this phase 1 study, obviously the goal is safety. This was a safe drug. The drug was studied both intravenously and subcutaneously. The recommended phase 2 dosing will be subcutaneous. The toxicities were typically grade 1 and 2, including CRS were grade 1 and 2, quite manageable. The grade 3 toxicities that led to DLTs were rash. Also, we saw some dysgeusia. And so the recommended phase 2 dosing is 405 micrograms per kilogram. In terms of efficacy, now, normally that's not an expectation for a phase 1 study, but here we found a response rate of approximately 70% in the RP2D dose, and that was in 13 patients, but there were actually almost 60 patients that had therapeutic dosing with similar response rates. So that's a very encouraging number, keeping in mind that historically in this unmet need, agents had a 20 to 30% response rate. And these responses were rapid. We saw them in triple-class refractory, penta-refractory. They were durable. In fact, a lot of the patients remain on treatment, some as long as 2 years. And so I think we saw, from a translational perspective, the pharmacokinetics support subcutaneous dosing, and it can be perhaps less frequent as well with maintenance setting. And the cytokines show T-cell activation. So in summary, this is a really exciting first-in-human phase 1 study targeting a novel protein, GPRC5D, and showing not only tolerability, but very encouraging efficacy.